have an interview. We're able to interview Dr. Ademola Denloye concerning breast cancer. We all know that October is a month dedicated for the awareness of breast cancer. Let's see this interview. We'll be right back.
There is no known cause of breast cancer. We just talk about conditions that predispose to having breast cancer. Of course, age is a factor. 95% of the breast cancer cases, or even higher, are women. Do you realize that men do also have breast cancer? Then habits, whether they are taking drugs, hormonal drugs for one form of treatment or the other, may be responsible for breast cancer. But worldwide, we really do not know the causes of breast cancer. Recently, some genetic studies have shown that some types of cancer actually genetic. They have genetic traits that predispose them to having breast cancer, and that's why some people have gone to test for the genes and then do a preventive mastectomy. Even before they have the breast cancer, they remove their breast and ovaries to prevent breast cancer. That's probably the closest that we have gotten to in terms of determining the causes of breast cancer. Well, we encourage women to do breast self-examination every day. So even before you get a lesion, you should learn to examine your breast so you understand and you know what your normal breast feels like. So the minute you feel an abnormal lump, that is when you should be on the alert to know that you need to get further diagnosis. You need to have further investigations to determine whether it's really a lump and what type of lump it is. So it's really the simplest is breast self-examination. Now we also talk about mammography, but we don't. Mammography essentially is not useful under 40 years. So it means that you cannot screen women under 40 because there are actually some breast cancers that develop at a much younger age. But you can also screen with mammography and breast ultrasound to determine whether there are any lumps, and you go on for further investigations after that. But essentially what we recommend, which is not expensive, which is available to everybody, is to do your self-breast examination, and it's supposed to be done every day. After you've had your shower or while you're having your shower, you do it. Definitely not all lumps are breast cancers. That's why we're using the term lumps. Lumps just means a tumor. And that's why in medicine, when you have a new growth, is called a tumor. Now, if the tumor is harmless, we call it benign. If the tumor grows aggressively and causes death or damage, that's why it's called cancer. But they all start as a simple growth. And that's why getting out the growth is important. You get it out and you analyze it and determine whether it is a cancer or not. Obviously, if it's not a cancer, you've taken it out, that's the end of the matter. But if it's cancerous, then you go ahead and give further treatment. Usually when teenagers and young female have all these lumps, it's usually due to what we call a fibroadenoma. And you will feel the lump. Older textbooks use the term a breast mouse, because when you want to feel for it, it's like it's quite slippery. So it's a firm, painless mass that you feel in the breast. And most of the time it is harmless. And when we take it out and we analyze it, we realize it's a fibroadenoma. So that is very common. Now, the reason why I said women should not do mammography under 40 is because it doesn't show much. You can do it, but the results are not, in terms of screening, the results, you are not likely to pick up anything because of the nature and growth of the breast. So mammographies are usually encouraged for women over 40. Well, definitely breast cancer treatment has changed and has improved the outcomes. But like you said earlier, early detection is the key. The greatest problem we have here is late detection, and that what makes treatment looks ineffective. But for the people who are detected early, a lot of them actually get treated and get healed. You start off by identifying the mass. Usually nowadays we just start with a fine needle aspiration, and that tells us whether it is cancerous or not. And then from that too, we also do what we call immunohistochemistry. We type the type of breast cancer that is present, by measuring some hormonal sites to determine which type of breast cancer is this, whether the subreceptor sites are positive or negative. And then the treatment has now changed into what we call an adjuvant treatment, where we start off with chemotherapy for about 4 sessions. Then you have the surgery, and then you complete the chemotherapy. And then after that, there's radiotherapy. Now, the reason why this has changed is very clear. Initial chemotherapy would clear microscopic metastasis, the metastasis that we cannot see with our eyes. And then it also tells us how effective the chemo is, because the tumor is in situ. So as you are giving the chemo, you can see the effect of the chemo on the tumor. And then thirdly, when you do surgery, the mass is usually much smaller. So it also makes the surgery easier. And then after surgery, you complete the chemo, and then you do radiotherapy. And then for some tumors who are hormone sensitive, you now go on to give hormonal therapy for 5 to 10 years. Oh yes, we, especially the ones that we treat early, because don't forget that the drugs are getting better and better and better. Even though they're getting more expensive, they are more effective. And it's usually, success is usually a function of how early. In some cases, the women choose not to even have a total mastectomy. They just want us to remove the tumor and conserve the breast. And that is done in cases where the tumor is very small. That's usually determined by the size. So if it's within a particular size, then the surgeon will go in and remove that tumor alone, and they leave the breast alone. And a lot of people have survived even with that minimal surgery. But there are other forms of cancer that we know the causes and that are preventable. So for a country like Nigeria, we need to emphasize a lot more on screening for the cancers that we can prevent. Colon cancer, cervical cancer, prostate cancers. All these cancers can be detected early. Some of them can be prevented. And at that stage, the success rate is very high, the costs to the patients are affordable, and minimal damage to the patient. So it's really, while I don't have anything wrong with cancer centers are, I don't think are the solutions. I think the solution is to have an ideal thing should even be have a cancer screening center in every local government in the country, so that you can prevent. This is what we call low-hanging fruits, right? You can detect these things very early, and that's why Lagos State government has now started the HPV vaccines for children from 9 to 14 that actually prevent cervical cancer before they are sexually active. So if you focus on prevention, you are going to help a lot more people. You're going to help millions of people. And then when you translate that into economic, the amount of money, when you translate that into human suffering, you would realize that it's going to have a greater effect. So yes, we need cancer centers because some people will still not benefit and they need to be treated. But emphasis at this point should be on prevention. A standard linear accelerator is about $7 million. How many can you afford in this country? So why do we then want to wait for $7 million when you can use the $7 million to set up screening centers and prevent the cancers? So really, for the oncologists, they would rather see the cancers being prevented rather than struggling to treat them, especially, and don't forget, it's not even the machine alone. You have to have the technologists, you have to have the nurses, you have to have, it's a whole gamut of sophisticated treatment, which we can't afford, basically. Even in government centers, the cancer treatment is still expensive. If you go to lose, you can't pay less than, it's about 1.5 million naira for a session of chemotherapy, and that's just a third of the treatment. So even for the poor, it's quite expensive. So we're better off preventing it. We'll do much more good to the society. That is not to say, I keep repeating it, that you shouldn't have cancer treatment centers or you shouldn't build more, but at least let us focus on prevention. That's where we can make a greater impact in the society. Lack of information is key. In fact, that's one of the reasons that make them come late to the hospital. Then religious inclinations, rejecting it when you can do something about it. It's God that has given us the knowledge and information to manage these things. And so those are the things that discourage women from coming to the hospital. But if the information is passed early enough, if the knowledge is there, like you rightly said, it's not contagious, so why should anybody be afraid of breast cancer patients? But what they need is a lot of compassion, a lot of empathy, and a lot of encouragement. And in some cases, financial assistance to make sure that they complete their treatment. So in a way, we should actually look for foundations that would assist in the treatment of breast cancer patients. There's so many wealthy Nigerians, and they can set up foundations that will help this. And it's not necessarily even individual patients. You can decide that, okay, we would help with drug importation, drug purchases, and make sure that the drugs are available at cheaper prices. Some may decide that they want to take over the management, one aspect of the management. And so it's information dissemination that is the key thing. We still have the wrong attitude to healthcare, and that's why a lot of people come to the hospital very late. But for those who are savvy, who are quite informed. They come very early. The tumors are diagnosed very early. They have their surgery. They have the whole gamut of treatment, and they're fine.
Thank you so much, Dr. Ademola Denloye. It's one thing for you to understand that early detection is key in saving lives, in the survival rate. If you find anyone that survived breast cancer, you'll find out that they actually presented early to the hospital. So if you feel any kind of lump, don't forget, the doctor also said that not all kinds of lump are cancerous. However, feel any kind of lump, please see your doctor. And that's the much we can take on this week's edition of the program. Don't forget to send a message, send a mail to okibeinchem@gmail.com or send a text alone to 07060865487. Thanking you for being part of this week's edition of the program. I will always add, health conscious people live longer. My name is Nkem Okibe. Join us same time, same station. See you next week.